Okay, hello, Dr. Ahmed. Many congratulations to you on this achievement.
Thank you, Dr. Shabana. I am happy to be with you today. This is a good meeting
Yes,
to help other candidates
yes,
to come pass the exam.
exactly. Yes. So since you have scored like 94%, it is really a very good score. I don't think anyone has achieved this score in MRCOG Part 3 till date. So
Uh,
how was,
yes, but
how,
I
how
have
did you do in the exam?
yes, the score has been achieved before in 2021
All right.
by Dr. Rudaina. It's my mentor in Qasr Al Aini.
Okay.
She has also got, I think, 84 or 83.
Okay. Yeah. Yes, yes. 85% I have heard.
No, 90, 94 or 93. Yes,
All
I
right.
remember.
Okay. All right. So it's so you also scored like your mentor. So that's really good.
Yes.
Okay. So you must be feeling great. And you're a proud member of prestigious Royal College of Obikaini. So, like, it was a long journey for you, isn't it? Like
Yes,
5%
unfortunately,
time.
I have spent about 2.5 years until
Okay.
pass. I my first attempt was in May 2022.
Yes. Okay. Mm-hmm.
Yeah, and after that, my first attempt, I get 60 from 61. So
All
it's
right.
very disappointed to me to
Mm-hmm.
fail about 1%.
Yes.
Then my second
Mhm.
attempt was in November 2023, in the last years in Egypt, center of Egypt. But it was a difficult exam and very difficult center. Only 9 pass from 120. It's a very
Yes.
disappointed the score in the center.
Yes. This time also exam was a bit difficult. Some new stations came. So how did
Yes,
you tackle them? I mean, if it was difficult, it must have been difficult for everyone. So what did you do differently this time in the exam and during the
yes.
preparation, everything?
Yes, it's a good questions. The key answer for this exam, it's you should a good very good preparations for the exam. The exam not difficult, not at all difficult, but it was very tricky. It was very tricky, but not difficult. So you need to prepare very good preparations. I take in the last time about 6 months,
Mhm.
very dedicated to the exam. I left my job. I take
Yes.
very long
Gap
vacations,
and leave. Yes.
about
Okay.
6 months. Also, you need very dedicated candidates, study partner that
Mhm.
can he wanted to pass the exam to
Yes.
be help you to pass and to recall and prepare yourself,
Yes.
practice well.
Mhm.
So I think the good preparations with a very helpful candidate partner, you can pass the exam easily. Not by score. The score it's 94 or 93 or 62. The score it's not matter, but I needed to pass. Only pass.
Exactly. Yes, yes. I have seen many people who just got 62%, 63% even. They were relieved at that at least they are free now. They don't have to re
Yes. The
Mhm.
exam it's a very
Yes.
put you in the prison. You surrounded
Yes.
with all people that say when you pass, when your
Mhm.
exam, do you study well? A lot of
Yes,
questions that can do put pressure on you.
exactly. And you're not alone in this journey. Your family, your kids, your like everyone is involved. You're not, it's not just your exam. It seems the whole family
The
is
whole
involved with
family exam, yes,
your
yes,
vacation and their vacation. Like no one is going anywhere. You're just studying. So yes, what you said, this puts you in a prison, this exam. Yes, it's like that.
yes.
And like candidates have asked so many questions, like they want to know how many stations we should practice every day and what should be the strategy at least 1 week before the exam.
Okay. The first, because it's my third attempt, that's give me a chance that I know about all the stations, I know
Yes.
about all the domains of the station. Okay, that's make it easy for me to can put a focused plan what I need to know to pass the exam this time. Okay, it's not my first attempt, it's not a second attempt, it's the third attempt for me. That
Hmm.
means I read or I recall all the recalls more
Yes.
than 10 times at least.
Yes.
So it make it easy for me to be focused. uh, that's the strategy that I followed in this attempt
Mm-hmm.
was I study by exam wise, not domain wise. Okay, I
Right.
take it the exam, the recall exam before. See, the first task was antenatal care, so I go through antenatal care. The second was early pregnancy. I go through early pregnancy. That's make my mind shifted from module to other module, from module to other module continuously. So I didn't lose any informations, or I didn't lose any tricks through all the preparations. But the module wise make you focus on this module now. After 4 or 5 modules, you will forget what you study in the first module, and you need to remember and recall it again. So you
Yes.
will lose your concentrations through
Hmm.
your journey to of preparations.
Right. So
So the
revision.
first thing you
Yes.
need to study the
Hmm.
exam wise. This is advice for the people, for the
Yes.
candidates who will attempt the exam for the second or the third attempt.
Yes.
It
Some of.
will be, this strategy will be difficult for candidates which will have appeared for the first time.
Yes, exactly. So recalls what I have seen that at least 10 stations are from the recalls. Topic is same, but they are twisted in the exam. So it has to
Exactly.
be thorough with the guidelines and that particular topic.
Not. I
Okay.
didn't read any guidelines after I have passed
I
my.
mean, recommendations. What do
Yes,
you say? Just
you
to
need
brush up.
uh, any material. I think
Hmm.
any material will be
Yes.
efficient, but you need to study or to practice with the candidates that have another course with other materials to can complementary to each other. Do you mean me?
Right. Yes, yes, so that you don't miss anything.
Yes,
Different
exactly.
courses cover different topics. Some will
Yes,
cover a few stations of in the early
I
pregnancy.
take a lot of courses, Dr. Shabana. I
Exactly.
take a lot of courses, and it was
Okay.
followed in your groups. It's a very
Yes.
helpful and very supportive group. I
Yes.
think no questions I ask you, and you didn't answer me.
Hmm.
You was very supportive. You were very supportive to me and to
Thank you.
everyone in the group. Exactly. So
Hmm.
I think I take a lot of courses with Dr. Muhammad Abdu, Dr. Hala, Dr. Surur,
Yes.
but I think it's not useful. The course it not useful or not helpful if not followed by practice daily.
Yes.
To
At
take a
the
course, attend the
yes.
lecture today,
Hmm.
and then lift the study to the next lecture. It's
Hmm.
not helpful and it's hopeless, really hopeless.
Yes, yes, you have to keep revising and practicing. So,
Yes, it's very important to keep your mind attending and focused. And can you summarize every task in your mind by
yes.
your way, not can just by keeping or saving these words as it's presence in the
Yes.
presentation or PDF, and can you call it in the exam, recall it. It's not helpful because every task you can change another word, that means another way of management. So you need to
Yes.
focus how to modulate the task in your mind.
Hmm. Yes, yes. If any twisted scenario comes, then we can at least adjust that template. Like template has to be there, but yes,
Yes,
you,
the
yes,
templates will help me to cover the general overview of
mhm,
the task, or a
exactly.
general overview of the modules. But in every task, there is a specific points in the
Hmm.
every domains that can give you the high score to pass easily, like in the safety domains, or managements, applied knowledge domains. In other communication with the colleague, communication with the patient, you should give the patients her complete rights to choose how to decide how her managements will be go on.
Yes. And initially, like when we are going for the exam first time, we all read the patient information leaflets. So, but gradually, I know after that, when you're going to for the exam for the second and third time, what you're doing is you're practicing and you're recalling what you have read. So, what
Yes.
you have read, you have to give voice to that thing.
Okay.
It's not just
Uh,
reading. It is,
Regarding to the candidates in the first time and the first
yes.
attempt for them,
Mm-hmm.
if the candidates just finish part two MRCOG within 6 months or 1 years at least, he didn't need to read the patient information leaflet, or didn't read any guidelines in part two. Okay, he need just to modulate his language, modulate his knowledge to be in lay language or lay knowledge that the patients can understand. Okay, this is will be easy for candidates that can English language is the first type, or can speak English easily. This is will be difficult, some sort of difficult in the candidates in Arabian or Egypt from any other Arabic country. Okay,
Yes. Mm-hmm.
by this way, you can modulate, or you can keep some sentence that can help you to some sort communications with the patient or communication with the colleague. Okay, and in other words, to take a patient information leaflet to read in
Mm-hmm.
every domain the patient information leaflet, you need to prepare at least 6 months to can
Exactly.
to
Mm-hmm.
can
Yes.
understand the patient information leaflet, what they want from the patient to know about her conditions, and what you know, what you should to tell the patients about
Yes.
her conditions in easily way.
Yes. Because
This is take a long time.
yes, yes. Because in the exam, what we have experienced that the first 4 minutes will finish in introduction, aim, agenda setting, and history taking. In the end, you have 4 minutes. 2 minutes, the role player will speak a lot. It happened in my exam also. I just had 4 to 5 minutes to discuss the investigation and management. Don't you think so? So, there, I mean, that
This
is
is
why
my
we say
was
practice.
big problem for first time.
Yes, that is why we say practice because then the important points will settle in your mind and you
Yes.
can reproduce that in the exam. And,
As I told you, this is my first, the big problem in the first time. I was finished the history taking in 6 minutes. Was very big problem for
yes,
me,
yes, it happens.
because I have a
Mhm.
four domains in just
Mhm.
4 minutes, without ask the patient about any concern.
Yes,
Okay,
it's
so if the
important. Concern is
history
important.
taking take more than
Yes,
4 minutes, you will mostly you will not pass the task. Exact. Because you
yes.
will lose the safety, you will
Mhm.
lose the applied knowledge, and
Mhm.
you will lose some communication with a colleague. Okay.
Exactly. Yes.
So you need to focus to take the history taking in maximum 3 minutes.
And it
Maximum 3 minutes.
and it has to
Okay.
be very focused. I mean, you don't have to finish the whole history taking template asking all
Yes,
the
you
10
need
to
to
12
take
questions.
very target history. You
Yeah.
don't need to ask about
Yes.
everything in the patient related. You need to take the present history and the information or the history that's me around the patient's presenting illness or present history, and just the allergy, drug intaking, surgical, medical. It's very important, but the psychological illness or the psychological history is not important. Some family history is not important. Okay.
Yes.
Regarding some social history is not important.
Yes,
So
it
you need
depends
to
upon
focus.
the scenario. Like if a patient has come in emergency, so there's no need
Yes.
to ask family history and so many other things like smoking, alcohol, recreational drugs. We can just omit those history taking
Yeah,
it.
in the emergency situation or the emergency task, you need to give bullets, not
Yeah,
any surgery, any medications, any medical illness. Just to give bullets. If the give bullets, you will finish the history in about 2 minutes only. You don't need to
yes.
ask about long sentence. When was last time you? It's not
Yes, yes.
will be
Are you
benefit.
following your GP for these medical conditions? We can just ask, do you have any medical condition? Or
Yes,
are you on any medication? Like simple sentences, just
yes,
to
it's
the
very
point,
very simple
very
sentence.
crisp. Yes, right. So, what else the candidates have asked? I mean, a study partner is important, isn't it? And
Very important.
not just
If
one. You can have two, you can have
I need to
three.
tell you, if you have a study partner, have
Mhm.
experience in the exam, and you follow, you help each other. Even you don't need to take a course if this is your second or third attempt. The course in the first attempt, it's very important to can just minimize and summarize how the exam will go on. Okay,
Yes.
the course
Mhm.
it's very helpful in this stage of the preparations. But when you understand how the exam go on, or how the exam will work, that the another work
Yes.
of preparations will depend on you, not the course, not the mentor,
Mhm.
will depend on you only. And
Yes.
you need a study partner to can help you to can achieve these preparations well, to can pass easily.
Yes, because at times when we are reading alone, it becomes boring, you get demotivated. So there has to be someone who is as
Yes,
serious as you to push you and to keep you motivated.
yes, it's very
Yeah.
absolutely yes.
Yes. So study partner
And another
is
point I
very
need
important.
to give it for the candidates,
Mm.
when you read the task, don't read the task randomly, not read the task without aim. You need you have in the put in your mind you have five domains. You
Yes.
should cover it in each task. Okay,
Yes.
okay. Therefore, when I read the task, I need to know what is the safety point in this task, what is the applied knowledge very which is can I which I need to recall it, I need to tell the patients to canvas. And you don't need to explain a lot of, you don't need to
Yes.
explain
Like you said,
every.
bullet points.
Yes,
Just
it's
write
very very
down.
important.
Yes. Exactly.
The exam not English exam not will
Mhm.
give
Yes.
you any mark about your English, it's good or bad. It's
Yes.
only it's
Exactly.
one word. If you say it, it's say okay, you take the mark.
Exactly. Even if your English is simple and you are able to convey the message, you're able to
Yes,
communicate with the patient and she's able to understand you. So that's enough because English is not our first language. For many of us, of course,
yes.
it is not our
Even
first language.
the examiner or the role player not well in English, so it's not English exam for you or your examiner or your role player. It's
Hmm.
just she needs about point, and you give this point. Okay, that's enough. You take the mark for this.
Yes. And what about the talk topics, Dr. Ahmed? What do you say? Like some talks are important. I mean, some when we were preparing, yes, recalls were there from the talk scenarios. Now there was
Uh,
the MI, from which came from the talk. So like candidates want to know how to cover it, how to cover the talk.
Okay. This is my personal advice, not some can take it and some can leave it. Okay.
Yes. Hmm.
I see that the recalls only
Yes.
can give you the success, and you can the pass easily without you need to read any talks or any other additional sources, because
Mhm.
you have 14 tasks. Okay, if you completely fulfilled the five domains criteria in just 8 to 9 tasks, you will pass. you will pass.
Yes, yes.
And the recalls or the previous task recalls, every from I think from 5 years ago, the exam come with at least 10 recall, at least 10 recalls
Mm.
from the 14. My first attempt, the 14 task was the same, the recall from the previous exam in February
Mm-hmm.
2022, the 14 task
Yes,
from the previous exam, so
yes,
no new task.
right.
So if you focused
Mm-hmm.
to completely recall the previous task by your heart, you will pass the exam easily without need to read any tags or
Mm-hmm.
any other additional sources. You
Mm-hmm.
need to focus because it's very simple. If the new task come in the next exam, it will become for all the candidates,
Yes, it will be difficult for everyone. Yes.
everyone.
Mm-hmm.
But the very big problem, if a previous recall come and you didn't answer well,
Mm-hmm. Yes.
okay, because the other candidates will give the full performance and the full criteria to covering this task will, because it's a very recall, bust recall, and everyone of us preparing all the recalls all the time, so it's not allowed for you to
Mm-hmm.
fill in any previous recall.
Yes, yes, and even if the new task comes, you can still pass in domains like communication
Other,
with the
exactly,
patient.
you can pass a communication with a colleague, you can
Yes,
in
in the
communication with the
history
patient,
information
even
gathering.
some history
Mm.
information gathering you can pass
Mm-hmm.
or take borderline. It's, I know very many colleague for me
Uh,
pass the exam without any applied knowledge. They can
yes. Mm-hmm.
take English well, they can take history, communications, and keep the patient
Mm-hmm.
safety, even if know anything about applied knowledge. Okay,
Exactly. Yes.
pass the
So,
exam. So it's the
mm.
communication exam mostly more than the applied knowledge, or you can give in a lot of information about obstetric and gynecology to can pass the exam. It's not
Yes.
the work like
Yes.
this.
Because it is not easy also to cover all the talks. So,
Yes, yes, it's very difficult. And you need to minimize your time, and you need to focus your time uh, in the previous recalls that you can secure about 10 to 12 tasks in the exam.
mm-hmm. Yes. So, like, one has to be thorough with the recalls, the recall topics. We have to practice those stations first. And then, if
Uh,
we
I,
have time, then
I,
yes.
I
Uh,
take the preparation for 6 months. Okay,
mhm. Yes,
the first 2 months I stay with my study partner. I have three study partners through this journey.
yes.
Okay, we stay about 6 to 8 hours to read the modules overview for the modules. The first 2 months. In the next 2 months, I prepare about, I mean, from 5 to 10 tasks per day. Per day, 5 to 10 tasks per day.
All
In the
right.
last 2 months,
Mm-hmm.
from my exam was in November, so in September and October, we prepared one exam in the night, one exam in the morning, daily.
So, it was like doing 14 stations in the morning and 14 in the night,
Yes, and we
right?
repeat it, we repeat it, we repeat it. I say early pregnancy module, early pregnancy task in the morning, and in the night he say or he recall early pregnancy in the evening.
Evening.
So we
Okay.
can repeat the task one way, one way.
Right. Yes, yes. So, like, it helped you both because when you are doing your task in the morning and your partner is doing it again in the evening,
Yes.
and you will be giving honest feedback, of course.
Yes,
Yeah.
it's very, very
Yes.
helpful, very
Yes.
helpful and easy. When my partner give me some points, you forget this. This is very important in the safety. This is you need to take to say this in the communication with the colleague. I
Mhm.
remember, and it's
It will be in your
become
mind.
deep in my mind.
If someone give you that feedback and pinpoints that you forgot this, That
Yes, I
point will be
didn't
there.
forget again.
Yes,
Okay, save it, and I
exactly.
didn't forget again. So it's very
Yes.
important. You will find study partner,
Mm-hmm.
especially if you attempt the exam for more than one time. And it's very important to this partner
Yes.
also attempt the exam for more than time,
Mm-hmm.
because if for the candidates for the first time, I think a study partner will not helpful for them, because they didn't have any background about the exam. They didn't
Mm-hmm.
have any background about what I say in here and what I shouldn't say in here. Okay,
Yeah.
it's will be difficult, so they need to become practice with other mentor. They can correct them or can give them feedback, right,
Yes.
uh, because they correct their mistake.
Right. And what about taking mocks on site and like online mocks? On site, like at the
Yes,
center.
it's a
Uh,
very helpful.
yes.
Mocks, it's very helpful,
Mm-hmm.
especially before the exam, to can evaluate myself. I am ready for the exam or not, because the mocks it's
Mm.
give the full picture of the exam exactly. So if
Yes.
you prepare the mock or attend the mock, will be confident, completely focused. This is can be sign about your performance in the exam.
Right. So better to go for the mock after full preparation. At least
Yes.
when you think that I'm done with the syllabus, I'm done with the recalls, so let me go for to attend this mock.
Yes,
Oh.
even with my journey preparations in the last 2 weeks, I take some task for from the recall, and they do exam for my partner. And when we stay, I give this task answer one in the as likely in the exam, and in the night he is
Mm-hmm.
the same thing. Give me some
Yes.
task I didn't know about it. Okay, we will go for this task now as exam, as this is a
Right.
small mock for us, but it
Mm-hmm.
was helpful.
Yes.
Have a task accidentally or in
Yes.
just one time. It's as I like brainstorming for me.
Yes, yes, brainstorming is the right word. Like you can do some random stations after finishing
Yes,
the module. So it will help you in revising as well.
yes,
Hmm. So at the end of the day, it is the candidates who are the ones who are facing the exam. So you people, like hats off to you people, and with such a score of 94%. Yes, it is exactly the lines which I have written here. It is your hard work, dedication, and determination. And of course, Dr. Ahmed, you are an inspiration to everyone, particularly to those candidates who feel like giving up after the third attempt. I have received many messages. That is why I wanted to arrange a meeting with you so that at least we can encourage them that don't give up it. Maybe it is not your time, but when your time comes, you will pass.
yes, it's very important. Everyone, you don't lose a hope. I know my colleague that take leave the exam after two or third attempt. He will give in her mind, I will not pass the exam even more.
Mm.
So you need to believe in yourself. You
Yes,
need to know with every hard work you will find the results by the end. So it's not matter the exam is difficult or the center is
yes,
difficult. You need to modify your way how to prepare the exam.
mhm,
Not take
exactly.
if you fail the first time, you not follow your steps for the second time in the same steps that's for the first attempt. You need to
Mhm.
modify yourself with every time until you pass. You by the end you will find some mistake that's not seen by yourself, that can't lead you to pass the exam.
Ye-
You don't need to get 94 or 84.
Yes,
You need just to pass.
just to
So
pass. Mhm,
you will be
mhm.
focused how to pass, not to get the high score. It's not your I know this is achievement, but not add anything even if you not pass. So I need just only pass. Okay,
Yes. Mhm.
so do what you should to do to pass the exam.
Yes,
Focus
like
clearly, given
exactly.
dedicated study partner. You
Mm-hmm.
need to study by different ways, like first in the module wise preparations, then exam wise preparation, then mock exam
Mm-hmm.
preparations. This is will help you to a lot of brainstorming in your brain. Every information in the task will be appeared in your mind when you read the head of the task. You will see the flashback for the task will be in front of your
Mm-hmm.
eyes.
Yes, yes. You will recall what you have read about that task.
Yes,
Yes.
yes, it's very will be very helpful for him.
Yes. So initially, those who are preparing and those who will go for the exam again, like we can advise them to initially go module wise and like they can,
Yes, until he
yeah,
understand the frame of the module.
yes. What they should understand the question, what needs to be like, what are the important points in the domain which you said. So
Yes.
it is not just like reading something and talking. It has to be whatever you're talking, you have to talk sense. So, and like what else you want to say? Anything, something to those who are going for the exam again? I mean, for the repeating candidates.
Uh, I need to say just one word. Be confident
Yes.
and be confident that you will pass for this time. I see many colleagues. They I will take it try this time. I not prepared well. Why? Why you will appear if you're not prepared well? I some I know some colleague without names. They postpone their exam before the exam, and the same day of the exam, they go for the mentors or the head of the exam, and they say, "I can't appear now, and I wanted to leave."
Mm-hmm.
Because he not prepared well.
Yes.
So you don't need to appear the exam if you don't prepare well. Take your time. Take your time. This is time. 6 months is even if take
Yes.
1 year.
Yes.
So because the failure is disappointed, even if
Mm-hmm.
you're not prepared and you know that you're not prepared well. But if you fail, it's very disappointed for you.
Yes, and to recover from that failure is really very hard. I have seen
Will take a long
friends.
time.
Yes, it takes a long time. Yeah, so better to be fully prepared because we
Yes,
are our
take your
best.
time. If even
Yeah.
you take a course now and you say some difficulties during preparations, be calm. Don't be panic or don't be stressed. Take your
Mm-hmm.
time. Even you not get understand what will happen in the exam, postpone the exam, or even don't take reservation for the exam this time, and take your time to prepare well and well until you be confident. Then reserve the exam and take your chance in this exam,
Right. Yeah.
because
Okay.
the exam will be very about £1, 100
Mhm.
1,000 pound. it's
Yes.
a, it's a
It's
number also.
expensive
a lot
also.
of a
Yeah.
lot of money.
It is a financial burden also. And
Yes.
yes, and it takes it affects you psychologically as well if you don't pass the exam. So you
Mm.
are affected very badly. Yeah. So all right. So those who are going for the exam, take your time and like go for it once you think you are fully prepared.
Yes, it
Yes.
is the complete or the most important advice that can I give them.
Mm-hmm.
Take the exam when you are fully prepared and you are confident that take I will pass this time. I will
Yes.
pass this time. If
Yes.
you don't can say that, don't appear the exam.
Mm-hmm. At least you should cover all the recalls and syllabus. You should
Yes,
be 100% from your side. It is
yes.
not that I have just read once or practiced just once, and I think that maybe by chance I will pass. That doesn't
No,
happen.
The exam not say the chance. No
Yes.
chances in the exam.
Exactly.
No the exam, the evaluation in every point in the exam, how you appeared, how your preparations, how your looks with the patient, your eye contact with the patient. This is can't
Hmm.
absolutely come with the chance. It's you
Hmm.
need to hard work, hard preparations,
Yes.
believe in yourself and your performance that you can
Right.
pass.
Hmm.
Even you reach to this point, when you reach to this point part 3, that means you are very good and you
Yes.
are have the full criteria to pass the
Yes.
exam.
Yes, because you are full of knowledge. Now, what you have to do,
Yes,
you just have to apply the knowledge.
yes,
And like many of the candidates, they're not working in the NHS, so they find it a bit difficult. That is why, as mentors, we are sitting here to guide you people, like how to go about the stations. And of course, practicing is very, very important, and covering all the recalls and all the syllabus.
yes.
So
Many
there's,
many candidates they say,
mm,
I am not practice obstetric gynecology in NHS, so the exam
mm,
will be difficult for me because I didn't know the rules. I didn't know how they work here, the rules of work, the rules of deal with the patients. So I will fail the or not pass the exam this time,
mhm.
or even the next time. It's not the way of you all work in NHS or didn't work. It's how to prepare, how to perform like as NHS doctor.
Yes, yes. Whatever you are doing in the clinic, you have to do the same thing in the exam.
Yes,
Because,
exactly. We with keeping
yes,
the patient in safety.
exactly. They want a safe doctor. So, yes, like you have given very nice tips, Dr. Ahmed, and it was really nice to have you with us. You gave your precious
Merci,
time. I
merci,
know it
Dr.
was,
Shabana.
you had a very busy schedule. We were in touch for, I think, since the day the result came. So today you had the time, and I'm
To
I'm very
celebrate.
grateful. I'm very grateful to you that you came and joined, and thanks for giving your the precious
Merci,
tips.
Dr. Shabana. I appreciate your performance and your effort in the groups. It's were very helpful, and you are like a light in the dark way in this journey.
Yes, yes.
So I
Oh,
wanted to
thank
thank
you.
you again for your
Thanks.
effort with me and your
Thank you.
support to me.
Thank
Very,
you,
very.
Dr. Ahmed.
And even if you need anything about your candidates or the exam, please ask me anytime. I
Yes,
am here for you.
sure. Sure, Dr. Ahmed. Thank you. Thank you so much. Thank you so
Thank you,
much.
Dr. Shaban. Thank you.
All
Nice to meet
right.
you.
Thank you. Nice to meet you too. Okay.